everybody. With the prevalence of mental disorders, there is an increasing concern of the use of corresponding medications.
Today we are going to talk about 3 types of drugs for the treatment of psychosis, depression, and anxiety, respectively.
We will focus on the mechanism of action, indications for use, side effects, and nurses' role of each kind of drugs.
Hello everyone, I will introduce antipsychotic drugs to you. There are 2 types of antipsychotics. One is typical, the other one is atypical. The typical drugs, also called traditional ones, including 3 main groups. Some common drugs are chlorpromazine, haloperidol, and zolpidem. The atypical drugs are some new drugs, also named as second generation, including clozapine, olanzapine, risperidone, and quetiapine. The mechanism of action of antipsychotics is blocking the attachment of dopamine to the postsynaptic nervous cell receptors, and the atypical drugs can be more selective. Antipsychotics are used for treatment of schizophrenia, acute and chronic psychosis, and bipolar disorder. Typical drugs are effective for the positive symptoms of psychosis, while atypical ones can both use for positive and negative symptoms. As for the dosage, chlorpromazine can be used by orally administration, 25 mg 3 times daily initially, or 25 to 50 mg IM injection. Olanzapine is available as water tablet IM injection. Taking 5 to 20 mg orally daily is a treatment for schizophrenia. Although atypical drugs have fewer side effects than typical ones, they may both have hypertension, dizziness, tiredness, and so on. The major side effects for typical drugs is movement disorder, others including agitation and aggressive behavior, neuroleptic malignant syndromes. The major side effects for atypical drugs is weight gain, others including granulocytosis. As for nurses, you need to educate your patients that taking antipsychotics regularly is important and inform them side effects. You also need to remind your patients to avoid alcohol. When using some drugs, you also need to pay attention to monitoring blood pressure, body temperature, and blood counts regularly. Thank you.
There are 4 types of drugs used to treat depression, which are SSRIs and SNRIs, TCAs, MAOIs, as well as atypical antidepressants. For SSRIs and SNRIs, they are the newest and most widely applied antidepressants in Australia. Fluoxetine and paroxetine are the most representative drugs. They work through neurotransmitter action. People who are suffering major depression, obsessive-compulsive disorder, panic attacks, bulimia can be given the medicines. Usually, patients will be suggested to orally take it in the morning with food. The dosage for fluoxetine is 20 mg daily at start and can be increased to a maximum of 80 mg per day as needed. The side effects of SSRIs and SNRIs include nausea, headaches, insomnia, etc. For TCAs, which improve the mood by blocking the reuptake of noradrenaline and serotonin, they are used to treat major depression, phobias, general anxiety disorders. The most commonly used TCAs are amitriptyline, imipramine. The dosage of amitriptyline will start at 75 mg orally per day and increase to 150 mg as total per day. The side effects of TCAs are sedation, poor concentration, gastrointestinal upsets, etc. For MAOIs, it works by inhibiting some enzymes. Therefore, the levels of neurotransmitters rise and the mood improve. MAOIs will be prescribed in the following circumstances: major depression, PTSD. Phenelzyne should be orally taken 50 mg 3 times a day initially, and the dosage will be increased to 60 to 90 mg per day. MAOIs can cause many adverse reactions. Common side effects are drowsiness, tremors, twitching, muscle spasms, edema, etc. There are some rules of nursing and administrating medicines. Firstly, Close supervision is required as suicide is a risk. Besides, the nurse should also monitor the patient's vital signs regularly. Furthermore, it is the nurse's responsibility to educate the patients to use drugs in the right way. Finally, ensuring a good adherence to medicines is important as it takes time for drugs to work.
Anxiety disorders are the most common mental health disorders. Anxiety is also a pronounced symptom of other mental illnesses. When it becomes disabling, diagnosis of an anxiety disorder, the use of anti-anxiety medications, and other therapeutic interventions are indicated. Anti-anxiety agents, which is also known as anxiolytics, can be divided into benzodiazepines and non-benzodiazepines. Benzodiazepines enhance the effects of the inhibitory neurotransmitter GABA. This results in a decrease in the individual's anxiety by an inhibition of neurotransmission. Clinically, they possess sedative and hypnotic properties that are useful in treating agitation and insomnia. Although cognitive impairment and paradoxical effects can occasionally occur with benzodiazepines use, these drugs are generally safe and effective in the short term. Most of benzodiazepines are administered orally. For instance, clobazam can be given 5 to 10 mg at bedtime and can be increased if needed to 20 to 30 mg. However, they can also be given intravenously, intramuscularly, or rectally. Side effects from the benzodiazepines including drowsiness, dizziness, headache, hypotension, and restlessness. These effects are especially evident with prolonged use and at higher dosages, which can lead to abuse and dependence. A sudden decrease in the dosage or abrupt cessation of the benzodiazepines use can result in symptoms of rebound and withdrawal. Hence, a gradual reduction in the dosage and administration of these medications is recommended. What is also worth mentioning is that older consumers are more vulnerable to side effects. During the period of using such medication, you should advise your patients to avoid driving or operating machinery, using alcohol or other CNS depressants, being pregnant. Buspirone and propranolol are non-benzodiazepine drugs. Compared with benzodiazepines ones, the former has no addictive or sedative properties, while the beta blocker propranolol can reduce certain psychological symptoms of anxiety rather than working directly.
In conclusion, we have introduced three kinds of medicines used in the treatment for mental health illness. They are antipsychotics, antidepressant, and anti-anxiety agents. Some advice can be given to the nurse to help patients overcome the lack of adherence. First, an active relationship between the nurse and the patient is important. Other methods including education about the medicine and the side effects, frequent follow-up and support, and motivational interviewing. That's all. Thank you for watching.